When we talk about nursing, some of the biggest concepts are all about family. But let's be real. How do you take those big ideas from a textbook and actually use them at the bedside or even on an exam? Well, that's what we're going to do right now. We're going to make all this practical, visual, and ready to use. Let's dive in.
All right, let's just jump right in with a question that seems super simple, but really, it's one of the most important questions you'll ever ask in your entire career. When you walk into that hospital room, who's the patient? Is it really just the person in the bed?
See, your answer to that question, it literally changes your entire plan of care. Knowing who your true unit of care is it the individual or is it the whole family unit? That's a skill that makes all the difference.
Okay, so before we can even answer that, we've got to be on the same page. Let's talk about what family really means when we're in a hospital or clinic. And quick spoiler alert, it has almost nothing to do with biology or marriage certificates.
Okay, this is it. The golden rule for your exams, for your practice, for everything. Ready? The patient defines their family. Period. Full stop. It could be their next-door neighbor, their bowling team, their best friend. You can't assume, so you have to ask. And one of the best questions is, who provides your day-to-day support? Whoever they name, that's the family you're working with.
A great way to think about a family's health is with 3 really powerful analogies. Think of it like this. First, you've got durability, which is like an elastic band. Even if someone moves out or there's a divorce, the band stretches but it doesn't break. That support system is still there. Then there's resiliency. That's the family's shock absorber. When a big stressor hits, like a job loss, they absorb the impact and adapt instead of breaking down. And finally, diversity. That's simple. It's the family's fingerprint. Every single one is totally unique.
Okay, let's put this into practice. A family takes in a relative who just lost their job. And to cope, they all shift their chores around. So what's happening here? Well, that is a textbook example of resiliency. They hit a huge bump in the road, but their shock absorber kicked in. They're adapting, not falling apart. That's a sign of a really healthy family.
Okay, so we know what a family is. Now we need to know how to look at them. For this next part, I want you to imagine you have 3 different lenses you can put on your nursing camera. And depending on which lens you choose, your whole focus is going to change.
First up, we've got the family as context lens. With this one, your focus is laser-sharp on the individual in that bed. The family? They're kind of in the background. They're an important resource, for sure, but they're a tool to help you reach your goals for the patient. For example, you're focused on the patient swallowing, and you ask the daughter if she can drive him to therapy. The patient's recovery is your #1 priority.
Okay, now let's pop on a different lens. This is family as patient. Now you zoom out, and suddenly the entire family unit is your patient. You're still aware of the stroke, of course, but now you're assessing the daughter's stress levels, which are through the roof. You're noticing the wife is exhausted and not sleeping. With this lens, caregiver burnout isn't just a side note, that is your primary diagnosis.
And our third lens, family as system, is the big one. This is the wide-angle shot. You see the family as this totally interconnected system, like a web. If you touch one part of the web, the whole thing vibrates. An illness that affects one person is now seen as affecting everyone. So your intervention isn't just about medicine, it's about getting everyone together for a family conference to talk about how this impacts the whole group, emotionally and financially. All right, quick check-in. Let's see if you've got this. You're assessing your patient swallowing after a stroke, and you ask their daughter to drive them to physical therapy. So who is the dead center of your focus here? It's the patient, right? The daughter is a resource to help the patient. That means you are using the family as context lens. You got it?
Okay, let's build on that, because sometimes the problem you're looking at right there at the bedside, it isn't the real problem at all. It's just the symptom of something way bigger hiding under the surface. We have to learn to think upstream.
So imagine you have a pediatric patient who keeps coming into the ER with really bad asthma attacks. You're doing your assessment, and the mom quietly says this to you. When you hear that, alarm should be going off in your head. That single sentence is the key to this whole clinical puzzle. And this is the perfect time to bring up the iceberg metaphor. The asthma attack you can see and treat, that's just the tip of the iceberg. Underneath the water is this huge, massive base that you can't see, and that's the housing insecurity. Moving from couch to couch means constant exposure to new triggers: dust, mold, stress. If you only treat the breathing and send them back to that situation, you're basically guaranteeing they'll be back next week.
So what's the move here? What's your priority? Should you go over the inhaler technique again, or should you call for a social work consult to help with housing? It's got to be the social work consult, right?
The only way to truly fix the problem and break this cycle is to go upstream and address the root cause, which is the unstable housing.
And that brings us to one of the most common and critical family crises you're going to deal with: the caregiver who is completely overwhelmed. And this is where family nursing becomes a massive patient safety issue.
Okay, we have to talk about the sandwich generation. Picture this. You've got middle-aged adults, very often women, who are literally sandwiched between two huge responsibilities: raising their own kids while also caring for their aging parents. They're being pulled in a million different directions, and this group is at the absolute highest risk for something called caregiver role strain. It's burnout, and it's dangerous. So your job is to be a detective, to spot those warning signs before everything falls apart. Are they not sleeping or eating like they used to? Do you notice them getting really irritable or even angry with the patient? Listen for key phrases like, "I just feel so trapped." And a huge one: are they neglecting their own health? Skipping their own appointments to take care of someone else is a giant red flag. And look, we have to take this incredibly seriously, because the numbers are pretty shocking. About 1 in 4 caregivers, that's 25%, ends up showing behaviors that could be harmful, like yelling or being too rough. Now, this isn't usually because they're bad people, it's because they are under an impossible amount of stress. But it's still a major patient safety issue that you have to intervene on.
All right, so you spotted the red flags. Now what? What do you actually do? Your response has to be fast, it has to be supportive, and it has to be something they can really use. Here are your 2 top priorities.
Priority number 1, and I mean number 1, is getting them some respite care. That just means getting them a break. Arranging for a professional to come in for a few hours so the caregiver can just get away. It is the single best thing you can do for burnout. Second, you have to provide real, hands-on education. Don't just hand them a brochure, show them how to do the dressing change. And then, this is crucial, you use the teach-back method. You say, "Okay, now can you show me how you do that?" That's the only way you know for sure they can do it safely. So let's bring it all home. You have a daughter from that sandwich generation. She's totally overwhelmed by her dad's new colostomy care. What is your priority action? You arrange a home health nurse visit. So why is that the answer? Because that one move knocks out both of our top priorities. It gives her some respite and backup, and it reinforces that critical, hands-on teaching to make sure dad stays safe and out of the hospital. And that brings us right back to that very first question we asked. But now, things look a little different, don't they? The next time you walk into a patient's room, who are you going to see first? Will it be just the person in the bed? Or will you see that whole, complex, vital support system that's trying to hold them up? Because seeing that, well, that changes everything.